Good afternoon. Ask people to move toward their seats, please. Good. Am I on?
No.
Better? Good. We are in for a substantial treat this afternoon. I have the pleasure, even as an internist, to introduce an orthopedist. So it's, as my capacity as president of the Alumni Council of the school. What can we say about McCollister Evarts? Mac graduated from the University of Rochester School of Medicine and Dentistry with a great class of 57. He completed his residency in orthopedics at Strong, then went to the faculty of the Cleveland Clinic and Cleveland Foundation, where he was appointed chairman of the Department of Orthopedic Surgery in 1970. Substantially benefiting the University of Rochester in 74, he returned as professor and chairman of our Department of Orthopedics. While at Rochester, Dr. Evarts was appointed to the Board of Governors of the American College of Surgeons, named president of the American Board of Orthopedic Surgery, the American Orthopedic Association, the Hip Society, and the Association of Orthopedic Chairs. In 1987, he was recruited to Penn State University, the Hershey Medical Center, where he served as chief executive officer, rising to senior vice president for health affairs and dean of the Penn State University College of Medicine. In 1994, he became chair of the board of directors of the Association of Academic Health Centers. In 1997, he was offered one of his most favored honors when he was elected to the Institute of Medicine of the National Academy of Sciences. In January of 2003, he returned to Rochester. In September of that year, after serving as interim CEO, Mac took over the appointment of senior vice president and vice provost for health affairs and chief executive officer at the University of Rochester Medical Center and Strong Health. His tenure is remembered for his inspirational strategic plan, which was especially noted for advancing research and the clinical enterprise of the University of Rochester Medical Center. Mac is recipient of numerous awards, but in August of 2006, he garnered a favored position as a distinguished university professor and professor of orthopedics at the University of Rochester. He has further served the medical school as the president of the University of Rochester Medical Alumni Council and as a member of the National Medical Council. Mac is currently professor of orthopedics at Penn State Hershey Medical Center, yet fortunately returns to Rochester every 3 to 4 months serving as a trustee of St. John Fisher College. So for you locals, you can call him up, take him out to one of the local brew pubs. He likes them all. It is my privilege to give you Dr. Mac Evarts.
Hey, thanks, Mike. That's far too much to say. Well, thank you very much for that introduction. I look out in the audience and I see a lot of old friends and faces that are familiar. And I think those of you who are here for Randy Rozier's talk, understand how the chair at Iowa wouldn't speak to me for 2 years after we recruited him. So that was really, it took me a long time to reestablish that connection with Reg Cooper, so basically. But we are privileged to have, you've heard a lot today about what's going on here at the University of Rochester, and a lot is really going on here. But I do look out in the audience and I see some of my classmates. They don't look too bad. There's an old saying, I think, that Mark Twain said something about, and that is, age is an issue of mind over matter. If you don't mind, it doesn't matter. So I want all of you who qualify for this to think about that. Well, a few years ago, Bob Joint was the dean and CEO here, and We were talking one day, and he started talking about hidden illness in the White House, or illness in the White House. And he actually was on a presidential commission that I'll talk about a little bit more, where Carter had instituted this commission to study presidential disability. So I thought we'd wander down this pathway here, a little different, not any hard science, but it's about the presidential thing. So the presentation will talk a little bit about the presidency, about presidential disabilities, about the president's physician, or physicians, as we'll find out, and then what are some of the consequences of hidden illness in the White House over all of our careers and before our careers. And then, of course, a little bit something creeping into the recent national press, if you will, is the 25th Amendment and how little we really all know about that. So, obviously, we're thought of having the most powerful office in the President of the United States in the world, and the Commander-in-Chief is supposed to be impervious to being sick, and has an expectation of great performance. When you look at presidential disabilities, it's a little frightening because there have been 8 deaths during presidency in our history of our country, 4 assassinations, and 4 presidents died of natural causes. Look at the illnesses. They're all over the place. Cardiovascular, cerebral vascular, renal failure, infection, major surgeries. All of these have had some influence on the decision-making by the presidents affected by these illnesses. The assassinations are well known to all of us. It's Lincoln, Garfield, McKinley, and Kennedy. And there are a lot of attempted assassinations. I was staggered by finding out, by reading, that there have been 18 attempted assassinations of our president. So not necessarily a very safe job. It's a little bit like being senior vice president and dean, but nonetheless. And there were certainly times when people did want to assassinate me. There's no question about that. Well, Teddy Roosevelt was interesting. Teddy Roosevelt was going to give a speech, and he had 50 pages of his speech in his breast pocket with a spectacle case beneath that. The guy shot him, went through the speech, bounced off the spectacle case, hit his chest. He started to bleed a little bit, but got up and gave his speech. And then he said, it takes more than that to bring a bull moose down. So, and of course, you remember, many of us remember Roosevelt, and then Ford and Reagan, of course, is the very current assassination attempt. Well, James Garfield in 1881 hadn't been president very long, and he was shot on July 2nd, but he didn't die until September 19th. And he died because you can't imagine how horrible his medical treatment was. People were probing his wound with their hands. There was no sterile precautions taken at that point in time. They didn't know where the bullet was. They couldn't figure it out, and ultimately he died of this. But they did not make Chester B. Arthur, who was vice president, they didn't transfer the power of office during this period of time. So we didn't follow what we should have done at that point in time. The president's physicians are an interesting group of individuals. They're entangled in a web of politics. I've known 3 presidential physicians, and their tales and their stories are remarkable. And they're torn between their loyalty to the president and what they may find medically and what they can say medically or what they're told to say medically or told not to say medically. And so there are these effects that work on professional judgment and ethical conduct. And it actually began with Washington. Washington had a major abscess in his leg. No one knew about it. And he almost died of that abscess. And it was kept away from the public, away from his troops. No one really knew about it. And the evolution of care has been interesting about the president's physician. They started out by being civilian, and then they became all military, and now it's a mix, and there's some consultants, and I'll speak a little bit more about this. There's a very effective White House medical unit, and it's several physicians. There are the White House physicians, and then there's the president's physician. And the president's physician is a political appointment that's not subject to congressional approval. Right now, there's excellent care in the White House. It's 24 hours. Everywhere the president goes, the president's physician has to follow him. Be right there, no matter where it is, around the world or anything. And obviously, that care is given to the president, his family, and the vice president. And their advanced planning, which is remarkable for all presidential trips. And if you've ever had a president visit your organization or institution, weeks are spent getting ready for that visit from just the medical standpoint. So that's where we are now with the president's physicians. Well, what about hidden illnesses? They're sort of interesting, and there are a lot of them, so I picked out a few. Grover Cleveland, and we'll talk a little bit more about him. He was thought to have cancer of the hard palate. He also had obesity. He was really big, and had gout. Woodrow Wilson, well known to most of you by history, massive hypertension, depression. Franklin Roosevelt, of course, polio, right on down through until he died of a massive stroke. Eisenhower, coronary artery disease, Crohn's disease, cerebral vascular disease. Not too many people knew about that. We'll talk more about Kennedy. Undergone several spinal surgeries. I knew the surgeon that operated on his back the first time. He almost died on the table, and they didn't realize totally that how bad he had Addison's disease, which is adrenal insufficiency, and so he almost died there. And then Ronald Reagan, of course, we remember that gunshot. And then Ronald Reagan went right on through lots of things, and at the end, he really did have organic brain syndrome. So let's talk a little bit about Grover Cleveland. He took up all of his chair, occupied that quite well. But he was thought to have had cancer of the hard palate. So what did they do? They didn't tell anybody. They snuck him in secrecy onto a yacht in East River, took him down below deck, had 5 doctors there, and he was thought to have had a malignant growth, as large as $0.25, so on and so forth. And that was O'Reilly, who was the White House physician then. So, okay, back to the Oneida on East River. 5 doctors, 1 dentist, no nurses, below deck. They strapped him to the mast in an upright position. That was sort of interesting. And then they proceeded to lop out half of his jaw, his hard palate, 2 teeth, under nitrous oxide and ether, and using electrocautery because it could have caused an explosion, but it didn't. And so they fitted him out with an artificial jaw and a rubber prosthesis and put him back into public, not telling anybody at all about this. So, of course, they said, well, they didn't get it all. So they took him back. Again, the same thing. And how they maintained the secrecy, I don't know to this day, but they did. The team was reassembled in secrecy. All suspicious tissue was removed. And so if I'd had Randy look at this tissue, which they did at the Mutter Museum in Philadelphia, which is a museum of pathologic specimens, they had a panel and they took his tissue and looked at it, and it was not cancerous. It was benign. So he didn't need that operation. So that's a little bit about how the various variables and presidential illnesses occur. So what about the secrecy? So at that time, they felt that there was a medical necessity, but there had to be political expediency. So irrelevant information was given to the press. And the president did absolutely conspire with political associates and physicians to cover up. This was the year of the cover-up. Now, what are the consequences? They weren't bad in this instance because we were right at the time where silver was the gold, or it wasn't the gold standard, it was the silver standard, and we needed to convert to the gold standard in the United States. And so he was able to come back to functioning as a president, and the Sherman Act was repealed, and we returned to the gold standard in the United States. Well, Woodrow Wilson, there's a picture of Woodrow, and he was in trouble from his youth, I believe, after reading a little bit more about him. He was sickly as a youth, anxious, depressed, had all sorts of symptoms of lots of different things, hypertension, arteriosclerosis. He had at least 6 documented major cerebral vascular accidents. His initial stroke was in 1896, and he wasn't elected president until 1913. And this stroke was denied by Wilson and by his wife. So then he had another stroke in 1904, and then in 1906 he wakes up one morning blind in one eye. I've been accused of being blind in both eyes, but nonetheless, he was only blind in one eye, and he had pain and weakness on one side, and obviously this was a stroke, and a poor emotional state. So Edith, that was his wife, said, "Oh, he'll be well in 3 months, don't worry. It's going to be fine." So he wasn't even in politics then, but he entered politics as governor of New Jersey in 1910 and had a bunch of little transient cerebral episodes. So he was elected president, and it's clear that most of the historians feel that his presidency was marked by a conspiracy of silence. They just didn't talk about this. So from 1914 to 1919, his disease got worse and worse. Went into kidney failure, had multiple episodes of cerebral ischemia and depression. And on October 2nd, 1919, he had a massive stroke. And this was really the beginning of the most celebrated cover-up of presidential disability. The cabinet would come to talk to Wilson. Edith would meet them at the door. She'd say, "Well, he's resting. You can peek in the bedroom." So they'd go upstairs, peek in the bedroom, and there's Wilson. Not really communicative. And they'd say, "Well, thank you very much," and they'd leave. So she was running the country for several months until his term ended. So what were the consequences of this? Well, there was a vice president by the name of Marshall, and he was not admitted to the inner circle. He really wasn't part of Wilson's cabinet. He was part of the cabinet, but he wasn't on the inner circle. And the Secretary of State at that time, Robert Lansing, tried to persuade the cabinet to make Vice President Marshall the acting president, but he couldn't get support from anyone. He couldn't get support from the rest of the cabinet. He couldn't get support from Congress to do that. So we had a person who was really totally disabled, and we had a country without a president for several months. So what are the consequences of this? Well, they could have been, or might have been, very significant. We almost had a full-scale war with Mexico. He was unable to focus on some of the early World War I events. And we were viewed sort of as an associated power worldwide then because of his presidency. And if you go on in the congressional elections in the odd year, his party lost their political base. There was failure of the passage of the treaty with the League of Nations, a major thing. And the government was thought to be out of business. Out of business. And you can understand why. So this illustrates, I think, quite clearly the need for a thorough public disclosure of a president's candidate's health, or a presidential candidate's health, and a careful selection of the White House physician, and a clear, workable method for removing a disabled president from office, and I'll speak a little bit more to that. Well, on to Franklin Roosevelt. And I thought that was a fairly apt remark. He became America's shining light by keeping us in the dark. And Franklin was pretty good at that. So the American public, and I didn't either. I was a little bit younger then, and when he was president. And I had no idea how sick he was, nor did my parents. And prior to his last election in his fourth term, he was out of the White House for weeks at a time, very ill. His workload had been drastically reduced. And the public, though, received the message when he was running for the fourth term that he was fine, he was ready to lead the country, and was ready to finish up World War II. That was going to take place under his leadership, and so on. McIntyre was his physician, the White House physician. Dr. Brune was a young cardiologist who was appalled with what was going on with him and said, my goodness, you're dealing with somebody with malignant hypertension. He's going to die. We've got to intervene. We've got to let people know he's not fit to run for office, and on and on and on. And he said, no, don't say anything. Don't tell anybody this. So he was kept from reporting his medical findings. Then the other funny thing, or funny, whatever, odd, whatever, was that he had a vast amount of medical records, as you can imagine, and they were kept in a safe, and after he died, no one could find the safe. So all the medical records of Roosevelt have disappeared. We know he had polio and he had sinusitis, but look at his hypertension. What would happen if somebody came into your office with a blood pressure of 260 over 140? That was a pretty heavy blood pressure. Congestive heart failure, and then finally, as you all know, he had a cerebral hemorrhage and he died on April 12th. And I'm not even sure his own president's physician, who wasn't a cardiologist, who really was sort of I'm not sure how competent he really was. He was a good friend of Franklin Roosevelt's. I'm not sure he knew how sick Roosevelt really was. And many people didn't. And Eleanor denied his illness. And she just couldn't believe it. So take a look at this picture now. On either side, this is Yalta. And there he is with a cigarette in his hand. That's really probably pretty good. And look at how gaunt and awful he looks, really, when you take a look at that. And all of you that are Rochester Medical School graduates know you'll talk to the family, look at the patient, examine the patient. You wouldn't have to spend too much time recognizing that he was pretty sick. So what are the consequences? Well, you all know about Yalta, February of 1945. He absolutely was impaired at that meeting, gave in to Stalin, didn't side with Churchill, which I think in retrospect was a mistake. There's divided opinion as to the outcomes of the Security Council votes at that point in time about the war against Japan and the sovereignty of Poland. And then, of course, he instructed Eisenhower to not let Patton go into Berlin ahead of the Russians. So, there were a lot of consequences of his illness at that point in time. Well, moving on to Dwight. He had a lot of problems, or not a lot, but some: bowel obstruction, regional enteritis, Crohn's disease. He had a heart attack in September of 55, a colostomy, and he had a little cerebral ischemia with his speech affected in 1957, and no one knew about that. The public was not informed about that at all. And there were doubts as to his reelection. Now, I didn't know this until started to look into this in a little bit more detail. The public was told he was absolutely fit to run for office. No problem. But privately, Eisenhower was advised not to run. So despite the whispers of a shadow presidency, there was no mechanism at that point in time for actual transfer of responsibility from a president who is disabled to the vice president. That just wasn't existing in our Constitution. There was an informal agreement about transfer of power, but nothing formally. So he was open about several things, but I've listed in, I guess it's red, but not everything. So there was some stuff kept from the public. Well, he's looking down, Kennedy. That's because he was really sick. He had Addison's disease, which I mentioned earlier. And I mentioned the near death following spinal surgery in 1955, before he was elected. But he declared he was the healthiest candidate for president in the country. He's been hospitalized more than 36 times, given last rites 3 times. So that would have to qualify as some sort of a presidential illness. And he had historic amnesia. And I'm just thinking about Bob Joint, who I shouldn't have, my mind is running various circles, but Bob Joint had last rites 2 or 3 times. He said he was really greased. So anyways, from the last rites ministered to Bob, he survived all of those. So Kennedy, here's a press statement that was issued by Robert Kennedy, his brother. Does not now, nor has he ever had Addison's. He's a little wrong about what causes Addison's. It's rare, but it can be caused by tuberculous destruction of the adrenal gland, but he did not have that. And so his presidency was really marked by subterfuge, secrecy, and deceit. It's amazing when you get his medical records to find out what was going on with the drugs he was taking. And again, he had such a long medicine administration record that was locked up in a safe. And then there was medical chaos. There were at least 5 physicians wandering around the White House trying to take care of him. I mean, it was just absolutely a mess, if you will. Dr. Travell was injecting trigger points for his back pain sometimes 3 times a day. And Krauss, who was the physician, that was a White House physician, was instructed to, quote, shade the truth. Now look at this record. Pretty interesting. Cortisone, heavy doses. Cortisone has a profound psychological effect after massive doses. Low modal. Paregoric contains opium. Phenobarb is a downer. Testosterone, who knows what happened there. I don't think he needed much. No, sorry. I didn't mean to make that comment. Amphetamines, this is a banned, a controlled substance. He was injected 1 to 3 times a day with amphetamine. I mean, it's just, you can't imagine that. And the doctor who did it was called Dr. Feelgood. Because he did feel good after he got injected. And this was Jacobson, who lost his license about 3 years after that. So what are the consequences? Well, you remember, I certainly remember very clearly the Bay of Pigs, the Vienna summit, the Cuban crisis. And so there is no question that his judgment was influenced by his illnesses during his presidency. Well, why do we have this? Why has this existed in this country? I mean, what the heck is going on here? There's always been a great reluctance to reveal any sign of weakness. I mean, all of us have never wanted to admit that something's wrong. And it's multiplied 1,000 times if you're a president. And there's been a lack of appropriate care in many instances. And almost all the instances, the political circumstances overrode the medical realities. So politics drove the pressure. And political pressures did play a role in the management of presidential illnesses. So it's a dilemma. It remains as a dilemma as far as the president's physician, because this person is handpicked by the president as a dual role. He's a spokesperson, but he's also a physician, or she's also a physician, in a very precarious position, if you will, as the White House physician. And so political considerations weave their way into this relationship. Clearly, the press was misled and the public was misled with O'Reilly in regards Garfield, Grayson in regards Wilson, McIntyre in regards FDR, Snyder in regards Eisenhower, and Travell in regards Kennedy. Well, what the heck was going on here with our Constitution? Was there something in our Constitution that would have helped us here? Well, there was the Presidential Succession Act of 1792, which said, if a vice president can't serve, then it passes to the Senate, President pro tem, and then the Speaker. Then they changed it in 1886 and said, no, this should be the vice president first, then the cabinet members by rank. And then in 1947, they said, no, wait, it's got to be vice president, then Speaker of the House, then Senate pro tem, then the Secretary of State. And that plays out, we'll talk about Reagan in a minute. And then, of course, the 25th Amendment was finally passed in 1967, probably as a result of the assassination of Kennedy. So the Constitution, and you know, I don't want you to necessarily, there'll be a post-talk quiz on this, but nonetheless, it's a way that the Constitution in Article 2 just says, okay, if a president is unable to carry on, then the vice president should serve. And if both of them can't serve, why then the disability can pass on to somebody else. But what it did was failed to provide for the orderly transfer of power in the event of inability of the president to discharge duties. Now we'll talk a little bit more about what disability versus inability means. And that's pretty key now in regards the 25th Amendment. So the 25th Amendment itself, just pretty straightforward. If the president dies or resigns, then the vice president becomes the president. But whenever there's a vacancy in the office of the vice president, the president shall nominate a vice president. And that's happened, in your lifetime or our lifetimes. And then whenever the president transmits to the president pro tem to the center that he's unable to discharge his powers, then they temporarily appoint the vice president, and then when the president feels better, he sends another letter saying, I'm okay now, and so the vice president is no longer the acting president. So that's Section 3. And then we come to Section 4, which is a little difficult to interpret or at least effect. So the vice president and a majority of either the principal officers of the executive departments or Congress can transmit to the president pro tem of the Senate their written declaration that the president is unable to discharge the powers and duties of his office. The vice president shall immediately assume the powers and duties of office as acting president. So that's the Section 4 of the 25th Amendment. Now you can see how that sort of be difficult to get done or happen. It's never happened. And I'm going to skip this over because all this says is that under the same circumstances, if the president writes back and says, I'm okay, then he gets back in office. But if at that time the Congress says, wait a minute, we don't think you are, then there's a process to remove him from the president's office. So Eisenhower did make specific arrangements for the vice president to succeed him in 1957. And Truman was very tuned into this, and he said, listen, we need to get a group of leading medical authorities together to try to help us solve this problem. And then Johnson had a very I think, a very eloquent statement about disability in the president. Reagan did evoke the 25th Amendment in 1985, but in 1994, Carter said, listen, this is not working. The 25th Amendment, we've got to examine this. So Carter put together 50 distinguished physicians, lawyers, politicians in a presidential disability commission, if you will. And Bob Joint was one of those individuals on that. And they authored a book called Presidential Disability a couple years after they met. So they this group examined the 25th Amendment in painful detail, actually. So Reagan, he failed to evoke either Section 3 or Section 4 of the 25th Amendment. But he, in a letter turning over executive power, he did it once. But remember when Reagan was shot? Remember Reagan was shot outside that hotel in Washington? There's always interesting stories. The bullet actually ricocheted off a bulletproof part of the car and then entered Reagan's chest. And so they got him in the car, and they were taking him to the White House. And one of the bodyguards said, no, we've got to take him to the hospital. And if he hadn't been taken to the hospital, he would have died, because he'd lost over 1,000 cc's of blood by the time he got to the hospital. So that was really something. And so then they have the war room. We've all heard about the war room, and in the war room are the people gathered around. And there was a guy who, Darman was his name, he was there, a junior something, not executive, but somebody in the political power. He was in the war room. They got out the 25th Amendment. He scooped it up and said, we're not going to look at this. And he took it away and locked it in a safe. So they couldn't examine the 25th Amendment to see what to do under those circumstances. And that was when Haig said, I'm in control here. And that's when Caspar Weinberger said, buddy, you better read the Constitution. Because he wasn't in control. He was secretary then, and it was way down the pecking order on who was going to replace the president at that time. So that's what happened with Reagan. But, of course, he didn't anticipate that he was going to be shot, so he didn't have a letter ready. I suppose you could have a letter saying, if I get shot, but not too many people think about that. So Bush had a cardioversion on May 5th, 1991. You remember Quayle, who had trouble with spelling? We all remember Quayle. I have trouble with spelling, but it always made me feel better. And so Bush said, well, I'm going to write a letter, and he's going to be the acting president. Well, everything broke loose. I mean, everybody got very upset by that, and so that he never did do that. He never evoked the 25th Amendment. So what are the concerns? Well, the concerns are the vice president and the cabinet, really need to obtain accurate and unbiased medical advice. I mean, they really do. And at this time, the determination is made by the president's personal physician, the president's physician, not the other physicians in the White House crew. So the Achilles heel of the 25th Amendment is really in its provisions for determining disability in the event the president is unable. That's not so hard. I mean, Reagan certainly was unable when he was on the OR table. But unwilling is another matter, isn't it? To certify impairment or disability. So it's quite clear, I think, now that the determination of presidential disability does remain a dilemma in 2017. The 25th Amendment, it's unable to discharge powers and duties of the office. No one talks about psychiatric as well as organic illnesses. The patient-doctor relationships are murky at best in there. There's an interpretation of illnesses by laypersons. There's no commission. There's no group of physicians that make judgment on what the illness is. There are limitations on the president's challenge of a decision. And then there's the question about how do you define inability to serve? Now, the physicians here, we all understand how you could declare somebody disabled. You know, there are many things that would disable somebody, diseases, trauma, whatever, gunshots, so on. But the inability to serve is a political decision, not a medical decision. So impairment, of course, is what I've just talked about. It's directly related to health status, and disability can be determined, obviously, is somebody so disabled that they can't function as president. So this working group really did provide a lot of information about the 25th Amendment. Right off, they said it needs guidelines, but we don't need another amendment to the Constitution. So that was the first step, and I think that's an important step, because as you know how long it takes to get an amendment passed. They obviously recommended that there be a consideration of transfer of power when appropriate, and there should be a contingency plan for implementation before inauguration. In other words, when you're elected to office, you ought to have a plan about what's going to happen. You're going to say, well, here's what I'm going to do. Here's my contingency plan. Here's who I'm going to appoint as my presidential physician. Here's the group of doctors that you can assemble to evaluate my conditions, and so on. And that hasn't happened, of course. And then, I mentioned this, the determination of a presidential physical and mental impairment is a medical judgment, not a political judgment. But the determination of presidential inability to serve in office is a political judgment. As a doctor, we should not be weighing in on that particular point. And I talked about the fact that it's important to appoint somebody as a senior physician in the White House. It's an important role. And this person needs to understand when he takes the role of White House physician that he's going to constantly be looking for the appropriate consultants in the various fields depending upon what the illnesses might be of the president. And then the Presidential Disability Group recommended that there always be an accurate disclosure to the public about the president's illness. And finally, their recommendation was that the 25th Amendment provision should be more widely publicized. And, you know, not a lot of people know about that, the 25th Amendment. So that brings us to the fact that the power of the president continues unabated, and the physical and mental health is of major concern. And I mentioned the fact that the recommendation of this group have not been followed. So Dean Rusk probably had it right when he said the international and national list of those who have carried great responsibility while ill is long, and there are many examples of decisions which good health might have turned another way. So I would end with that. There's some references in case anybody's interested. And I would leave you with one final thought. And this is a thought that some of us in this audience have, and I have it frequently, and that is I thought growing old would not come so quickly. So I'd be happy to answer any questions that there might be, comments or questions. Yes, ma'am.
You mentioned inadequate care of a number of medical care physicians. How much was inadequate by the standards of the day? And also how much of the care or inadequate care was for political
reasons?
Yeah, I guess
I think if you go way back to Washington and in that era, probably Garfield, that was probably relatively standard treatment for those days. But as you move up to Wilson and others, that there clearly people knew better, or at least could have provided better care in that particular time.
And for Kennedy, was that political?
For Kennedy was absolutely politically manipulated, the whole thing, the whole career. I mean, when they came out with bold statements about how healthy he was when he was really sick. And if you look at pictures of his inauguration, and I should have put some in, but I didn't. He fit, healthy looking, vigorous, and a few months later, year later, his face is filled out. He's got effects of progressive cortisone injection. So clearly he had changed. Yes, way up in the back there.
Is there any interdependence between the White House physicians and the president's personal physician in ascertaining the health of the president?
Yeah. Yes, there is. They're all there in the same. They have a unit that's, it's a medical, sort of an outpatient unit right there in the White House area. And they do communicate. And more so lately, more so in the past, probably last two presidencies, a lot of communication. I knew Bill Lukash, who was Carter's personal physician, and he says they worked all the time. But when a push came to shove, it was his responsibility to declare and talk to the press about what was going on with the president. The other physicians can't. They don't. They've got a muzzle on them. So, yes.
There have been a number of public statements by mental health professionals about our current president's stability. What's your opinion about the appropriateness or value of this?
Well, only a few of us remember Goldwater. And Goldwater was thought to be unstable at best. I mean, people were claiming all sorts of things about him. So a group of psychiatrists at that point in time declared him unfit for running for office, Goldwater. And the American Psychiatric Association came out and said, you can't do this. You didn't examine him. You can't make that opinion because you never examined the patient. So for years, there's been a muzzle on that kind of examination. Recently, a group from Yale, actually, of psychologists and psychiatrists have spoken out fairly vigorously about the mental health of our current president. And the American Psychiatric Association has reversed its decision in saying, if you have enough evidence, so if you're a physician, say you're a cardiologist, and I give you an EKG that shows SD changes and I have chest pain and on and on and on, you probably could legitimately make the diagnosis and say I have coronary artery disease without examining me. So that's where that stands right now. Not all that satisfactory, but that's where it is right now. Yes, sir.
So I think a lot of us during the Reagan administration, the latter part of it, had legitimate concerns based on the way he responded to certain questions that he had early to perhaps beyond that Alzheimer's disease. The question comes, who would trigger it? You have a president's physician, who's his personal physician, and Reagan's not going to go, or whoever the president said, I think I have early Alzheimer's disease, do you want to examine me? What kind of criteria would you use? You can't use them in your state. I think these would be issues that really, it's just hard to imagine how you begin to encode those. Who would trigger the inquiry?
Well, that inquiry could be triggered by the vice president.
Yeah, it would have to be at a level.
Absolutely, yeah. I mean, you could have all sorts of public outcry, but that's not going to do it. And you have to face the fact that a party is in control of the Senate and the House, whatever, under any time. And so that weighs into it too. But there's no question that at the very end of his career, Reagan did have Alzheimer's, I think, or whatever. Other comments or questions? Yes.
You know, if you're in a position as the physician of the president or the White House, and a condition may be temporary or not,
Right.
and there's some critical international issues that goes on, the question comes up, although you want to be altruistic and explain everything to the American people, it may not be in the best interest overall to reveal things.
Well, I think that's why I didn't mean to imply everything should be revealed. The Presidential Commission on Disability, the Presidential Disability, said a certain amount of information should be made public. But under those circumstances, you'd have to use your judgment. Yeah. Yes?
Matt, thanks very much for your talk. I learned a number of things that I had no detail, particularly about Wilson's problems long before he ever came to the White House. You mentioned Eisenhower's inflammatory bowel disease. It turned out that when I was in the service, I happened to be in Bangkok at the time. Circuit riding was a 2-star medical general who happened to be in the operating room the night
Yeah.
the Surgeon General operated very, very quickly to relieve that obstruction.
Right.
He had side-to-side anastomosis. He was roundly criticized for that because the potentates from outside were saying he should have done a resection.
Right, right.
And even though he hadn't had a heart attack and stroke yet, Eisenhower was sick. They knew that he had some vascular disease.
Right.
And Heaton's thesis, and he was borne out to be right, was that he had to have as little anesthesia time as possible in terms of risk for this chief executive undertaking.
Sure.
So it was a quick in and out, 30 minutes,
Right.
skin to skin.
Yeah, I remember that.
And just a quick, and the other thing was, and this maybe was Heaton's clinical judgment, it gets back to that surgery and clinical judgment. He said what he has, and he did it by palpation, is dry ileitis. He said,
Oh, yes.
This is burned out, it's obstructed, but if we just bypass it, we'll solve the problem, and this man will still live. And this fellow told me a 2-star by then. He was a junior medical officer when he was in the operating room in 1955. He said they knew that Eisenhower had Crohn's disease. They suspected his first attack was at West Point when, as a cadet, he had appendicitis, and so to speak, and that's a classic story.
Right,
They later
right.
went back and looked for the past specimen from West Point, and of course they couldn't find it. But he said they had been doing, before that point, the reason why that night, in the middle of the night, they knew what was probably wrong with the obstruction, was they had been doing barium minimus with air contrast and upper GI series with small bowel follow-throughs on Eisenhower every 6 months. So they've been following
Yeah, sure.
the
Right. Yeah.
inflammation in his
Yeah.
small bowel and the potential for sites of obstruction. So they had some information on it before it suddenly
Before that happened, yeah.
had that even.
Well, I think Eisenhower had pretty good care. I mean, I think he did anyways.
Called up to White House
Yeah, absolutely.
to visit him in
Yep.
Fitzsimmons
Right.
Hospital in
Right.
Denver.
Yeah. Okay, guys, thanks a lot.